Welcome back for another 4-H horse video. We are talking today with Dr. Randy Plaisance, who owns Castaway Animal Clinic, and he handles large animals. Thank you so much for joining us today, Dr. Randy.
Thank you for having me.
So, Dr. Randy, why did you choose to be a veterinarian?
I actually did not take a route that was straight through, as we can describe. The typical route to vet school would be graduation from high school or an equivalency, and then a degree from an undergraduate university where you would take the courses that are necessary to apply to vet school, and then applying into veterinary school and doing 4 more years in vet school. I did not do that route. I actually got a degree in animal and dairy science, and when I graduated with that degree from Auburn University, I entered into livestock production. I was in the purebred beef cattle business for approximately 2 years, and then I entered into the commercial dairy business for approximately 2 years. And it was during those experiences that I worked closely with our veterinarians that served those 2 production units, and realized that I had a very strong interest in doing that. And so I went back to school for an additional year to take some classes that I did not get covered during my first run through undergraduate at Auburn, and applied to vet school then. So I actually didn't start vet school until I was about 27 years old, which is a time when most veterinarians would have been graduated and already been working for a few years as a veterinarian. I chose to do that again because I was interested in what the veterinarian's role was on the livestock units in which I was involved. These were roles of animal health that involved preventive care, as well as sick animal treatment, and also aspects of public health with regard to milk quality and improvement in milk quality in a large commercial dairy. So when I went back to veterinary school or veterinary college, I had the idea that I would probably be mostly a cattle veterinarian. I had a strong interest in beef cattle and in dairy, but I also had a strong interest, and I had some background in my life in horses and in equine medicine. So I was interested in doing those things, but I also wanted to learn about all species. And in vet school, you're required to do that. Regardless of what your particular interests are, you have to achieve a pretty high level of skill across all species before you can graduate. And you get some opportunities later on in vet school where you can maybe pick more to your interests, certain classes, but I'm glad that we learned how to do everything, and I still enjoy, although my practice is primarily equine, I do a good bit of cattle work, particularly advanced reproductive work, embryo transfer type services, and I still do dogs and cats. Not as much as I work on horses, but I still do enough of them to remain very interested in them and to remain competent in offering clients that service. And it's kept the profession very interesting to me and keeps every day very exciting.
All right, so how often should our horses see a veterinarian, and what do you usually do in a typical vet visit?
So the answer to how often depends mostly on the life stage of the horse. And by life stage, we mean essentially the age of the horse broken down to a young horse, a foal, a juvenile type horse. That would be one that's been weaned from its mother, but maybe not quite ready to ride and to put into a real active performance program. Then an adult horse, and then a geriatric or senior horse, which would be an older horse. So the needs of those horses are all different, just simply based on their age. Foals we usually see right when they're born. We'll usually see them again 1 or 2 more times prior to weaning. These would be visits where we're examining the foal for proper growth and administering age-appropriate immunizations or vaccines. We'll usually then see that animal again when they're approximately a year old. And at that time, the visits will become somewhat less frequent. As we transition into the adult life stage, we generally recommend at least 1 wellness visit per year, sometimes 2. And that'll often depend on what the expectations of the owner are for the horse. In other words, what is the horse being used for? And are there any issues that we've discovered in past visits? So for instance, a horse that's quite healthy, doesn't have any ongoing issues, and is in a low performance type program, we might only see that horse every 6 months to 1 year. Where a horse that's in an intensive training program and may have some issues that need to be watched more closely, we may see that animal every 3 months to 6 months. And that generally gets determined by the veterinarian after examining the animal and also consulting with the owner to determine what might be best. As the animal gets older and starts to enter the geriatric stage, that can be an indication that visits need to be more frequent. And the more common reasons that we'll have those more frequent visits will be if the animal develops a disease that might be somewhat age-related. These diseases would include orthopedic disease, endocrine disease, in other words, the development of Cushing's disease or some type of metabolic disease. Hoof health can become an issue. And then a really common one is dental health. As horses enter the geriatric stage, their teeth experience age-related changes that can necessitate changes in nutrition and make dental care need to be more frequent. And so, again, it's based on the horse's individual needs, but it would not be uncommon for those visits to again be on the 3 to 6 month basis if the horse's needs require that, but at least every 6 months in the geriatric or older horse is usually indicated.
All right, Dr. Randy, what do you do when you either go to a farm or you have the horse come here? What is a typical vet visit?
So the typical vet visit, I guess, we would consider to be a wellness visit. And this would be a visit in which the animal is not coming to see us necessarily because there's a particular illness in place or a lameness in place. The animal is being brought in because the owner wants us to help them prevent issues in the future by examining the animal and making recommendations. And so, to put it simply, that's what we do, is we examine the animal and then we make recommendations about what would be the best practices to keep that animal healthy and to prevent disease, to promote the use of the animal if it's an animal that's used for a particular type of companionship or sport. So the most typical visits would be in adult horses that are being used for a particular purpose, and the visit would include a physical examination. We listen to the animal's heart, we listen to the animal's lungs, In the horse particularly, we're going to listen to their intestinal sounds quite closely. We're going to examine that animal all the way from their nose to their tail, looking for any abnormalities in breathing and discharges from the nose, the eye, the mouth. We're going to try and detect any odors that might indicate that something might be going on with that animal that's not healthy. Usually we will place a speculum in the animal's mouth and perform an exam of the teeth with the mouth held open so that we can very clearly see each individual tooth and the other structures, anatomical structures within the mouth. We look at the animal's ears, we palpate all of its bones and joints, and pay particular attention to the feet. We're going to look at the rear of the animal to make sure there's no signs of diarrhea or any other discharges that can indicate poor health. And then we'll usually watch the animal move around. Even if it's not a sport animal, we'll at least like to see the animal walk around and look to see that they're able to move freely and comfortably. Based on that exam, we'll recommend any changes that might need to be made to diet, exercise routine, environment, hoof care, dental care we will usually perform ourselves if needed, and then we'll make recommendations for follow-up. This also is a time when we usually will apply any immunizations that are indicated for that horse's life stage. For some horses, that means immunization to prevent diseases that are transmitted from the environment, from mosquitoes. For other horses that have a more active lifestyle or see more horses in their daily life, we'll start also incorporating immunizations for infectious diseases that can be transmitted, contagious diseases, I should say, that can be transmitted from horse to horse or from other species to the horse. And so that all depends on, again, what the horse is used for, how the horse is kept, and what the owner's expectations are. Our job is to talk with the owner about what the facts of the matter are so that they can help us make the best decision of what's best for that particular horse.
Dr. Randy, we do have a whole lot of 4-H'ers who travel with their horses to shows, to trail ride, to camp with them. Is there anything special that they need to do with their vet to be able to travel with their horses?
So this could also have been mentioned during the wellness visit, and I did not specifically mention it, but that is a great question because in all of those instances, to my knowledge, a test for equine infectious anemia is going to be required for those horses to participate in any of the events that you just mentioned, and also to travel to and from those events. That test is referred to as the Coggins test, and it is the blood test that most of you that have horses will be familiar with, that your veterinarian will pull during a yearly wellness visit. In almost every case, it is only required once per year. That test can be run on either a triplicate form that you're probably all fairly familiar with if you've had horses for a while, or now becoming more common, and I think even really becoming standard, is a digital form that you can access by management of your own account, to where you can pull that form offline when you need it to travel or to present at an event to prove that your horse has been tested as the event requires. Additionally to the Coggins certificate, a certificate of veterinary inspection can be often required, and your veterinarian can help you determine whether or not that certificate of veterinary inspection is required based on the requirements of your destination. Destination requirements can be variable. They can change based on the state from which you are traveling. They can change based on the state to where you are going. They also can change based on the class of horse that you are hauling. So certain states might have requirements for bringing in an intact stallion or a mare that will be used for breeding purposes. Those requirements may be different than bringing in a gelding for a weekend show. So So your veterinarian can help you determine which tests might be required, which forms are required, and how frequently those forms need to be renewed.
Dr. Randy, I think our last question of the day is going to be, what should our 4-H members have on hand at their house to be able to handle some basic first aid requirements by their horses to get them either to you or just in case it's something small that they can take care of themselves?
Okay, that's a really good question, and we spend a lot of time on this with owners because no matter how thorough you are in trying to prepare and prevent, there are things that come up that will leave you needing veterinary care, and in the meantime, there may be things that your veterinarian would like for you to do or that you can do to better that situation before full veterinary care is available. Some of this is certainly my opinion, and different veterinarians will have different preferences on this, so I would encourage you to talk with your veterinarian about this particular question. And I would also say that anything that I say that you might want to have on hand, there are proper ways to use and apply these things, whether they're materials or medications, and your veterinarian needs to guide that process in terms of what the proper way to use them in certain situations are. But I would say some good things to have on hand is a thermometer that can be used rectally, like an inexpensive digital thermometer to determine if a horse has a fever. There's virtually no other way to do that that's accurate or that costs as little as the thermometer that you would buy in any drugstore to use on a human. That's a good thing to have. I think that being capable of determining what your horse's heart rate is a really good skill to have. Now that can require a stethoscope, but there are also ways to do that that don't require a stethoscope. And your veterinarian should be able to show you how you can measure your horse's pulse, because that can be a really important thing to know if you're trying to determine, is this animal in pain or not? And so we'll often, particularly with some more experienced owners, if they think they might be having a problem, but they really just can't quite tell for sure, help them by asking, well, what's the horse's pulse? What's their temperature? And sometimes those two things can indicate that, yes, we do have a situation where we need to be trying to move quickly here. Other items that can be kept on hand would be ointments for scratches and abrasions, bandaging for scratches and abrasions, particularly covering up wounds on the legs until they can be completely treated, even if it might be indicated that they be sutured or stitched. Some owners are capable of, if they've been shown properly how to use these materials, of applying a bandage that can slow down any blood loss and might make contamination of the wound less prior to that wound being treated. There are issues here that need to be considered regarding safety. Anytime a horse is sick or injured, their behavior can be altered, and so owners need to be very careful about handling their horse in these situations and understanding that their horse might act a little differently than they normally would. But bandage material, antimicrobial ointments, and other first aid related items, maybe like gauze, gloves to prevent contamination of your hands with fluids, and I think certainly a thermometer are all things that most owners can use. Your veterinarian might also add, based on specific conditions that your horse might be susceptible to, other medications to be used in other instances on their advice and on their direction.
All right, Dr. Randy, is there anything else you would like to share with our 4-H members before we go?
I would like to say some positive things about our profession that are based on my experience. I've been a veterinarian now for almost 12 years. Before I was a veterinarian, I worked closely with veterinarians for many years. I grew up working in veterinary clinics as kennel staff and assistant, and it's been a really, really wonderful profession for me. I know many of you might have some interest in pursuing veterinary medicine or veterinary technician training, and I think they're both wonderful, wonderful professions. There is a tremendous satisfaction that comes from working with the individual animals, working to keep these herds healthy, but also in working with the people that own and care for these animals. I've built tremendous relationships and friendships over the years that I think are truly unique to the veterinary client patient relationship. And so I'd encourage you all to pursue that. Do your very, very best to get as much experience around your interest prior to making your educational decisions. So do your very, very best to find yourself around what you think you're interested in so that you learn a little bit more about it firsthand before you commit to a certain path of training. And I know many veterinarians, most veterinarians I would say, are quite happy to schedule volunteers and volunteer assistants and people to shadow so that you can use those experiences to make better decisions about your educational choices. And realizing during COVID that access might be somewhat less than it is, but still make an effort to do whatever you can to become more familiar with what your choices might be before you have to make those choices. And if I can ever be of assistance in answering questions, I know I'd be glad to, but I also suspect that your veterinarian would be very happy to field those questions as well, and I encourage you to ask. Thank you.
Well, thank you, Dr. Randy, so much for joining us today and letting me come out and film you for our 4-H members. We really appreciate it.
Thank you for having me.
Have a great day.
You too.